They shall not go for transplant because diabetes, high blood pressure, these hairs may not grow that well. Some important checklist when you are planning your hair transplant surgery. Patient should carefully consider the following checklist to ensure the procedure is performed with caution. Number one, chronic health issues. So if you are having some chronic conditions like diabetes, high blood pressure, or those who are taking blood thinners should have a thorough evaluation by their physician before proceeding with hair transplants. People who have other medical conditions like renal or something, they should not go for a transplant. Secondly, people who have chronic scalp disorders like psoriasis or seborrheic dermatitis, they shall not go for transplant unless those conditions are addressed, because post transplant you will have a lot of itching, flaking, extra scabbing and crust which might even dislodge your grafts. So that is very important. Now third condition here is alopecia areata. So as we know, alopecia areata is an autoimmune disorder and you can have patches in the donor area as well as in the recipient area. It is possible that your grafts which have been recently implanted might get rejected because of the autoimmune problem called alopecia areata. So be safe, don't go for surgery, don't rush for a surgery when you are having patches. Another condition is keloidal tendency. So if you have keloidal tendencies, you should avoid hair transplant procedures as they may have a higher risk of abnormal scarring, especially if you are going for FUT surgery or FUE from the nape of neck. Transplant in scarred areas, patients who have burn scars or skin diseases like pseudopelade, lichen planus, where there is scarring, there are chances that these hair may not grow that well in these areas. So it's better always to go for a test patch of small hair so that we know, we are sure that these hair grow. Wait for around 4, 5, 6 months, and unless you are convinced, don't go for a transplant. Okay, so people who have early hair loss or thinning shall not just straight away jump for a transplant. People who have diffuse thinning or female pattern hair loss, a detailed consultation with your doctor is mandatory, and to find out that you are the right candidate for transplant. In diffuse unpatterned alopecia, there are chances that medicines can grow a lot of hair. Doing a transplant in such cases can sometimes be problematic if you try to overdo the things. However, small subtle areas can be addressed through transplantation. Now, another important thing is the age. If you are young and you are planning for a transplant, just check the pattern of your hair loss. If your hair loss has been aggressive, try to stabilize it. You know, don't go for flashy hairlines. Those are very lowish hairlines. These hairlines will be a liability for life, and whatever goes empty behind that hairline would really look bad. You will end up having a band of hair in this portion, and you had already invested entire donor in this area. So if you follow these things, some important instructions, you will be safe. So please, if you are going for a transplant, make sure that you check all this before even considering a hair transplant. Thank you. Love yourself. Stay blessed. And if you have questions, if you want me to make a video on certain topic, write down in comment section. Thank you.